Hey, Dental Nachos crew, this is Paul, Dr. Nacho. I'm here between two periodontists, like between two ferns with Zach Galifianakis, and between two periodontists here are going to share with us. We have exciting 2 courses coming up on Nacho Zoom CNTV. These awesome periodontists are also going to describe what they have planned for the future. So welcome, Dr. Fadi and Dr. Dmitriy. Share with our Nacho audience who you guys are, what you do in your dentisting life, and of course, your favorite Nacho topic.
All right, go ahead, Dmitry.
Dmitriy Ivanov, periodontist here in Los Angeles. Went to UCLA Dental School. Been kind of LA native for the last, I would say, 15 years since I moved to America. Been teaching a lot of courses. Been hanging out with Paul once in a while in Philadelphia, eating nachos, and just been kind of part of the Nacho family for, I guess, since 2017.
Yeah.
Met Fadi also kind of a year or 2 ago, and we've been kind of hitting it off about soft tissue because he has as much love in soft tissue as I do. What kind of my favorite Nacho topic is always soft tissue. That's the only topic.
Now, I want you to share for the Nacho audience, because I know there's like 1 million people watching in. This is really interesting to me, if you can help our Nacho verse understand me, right? So I started off mostly meeting people in person, and then I made a Facebook group. But you're one of the first people who met me on Facebook and then met me in person. How would you say my Facebook persona compares to my real life persona? Same, different, both enthusiastic and crazy? What would you say?
I think at first you came off a lot differently than when I completely understood you. You were, you're like that kid that likes to pick a fight, but I didn't think that. The reason behind you picking up the fight when I kind of started watching you was a lot different than what I thought. Like, I always tell people you try to make people think by making them very uncomfortable.
Yeah, I say it kindly annoying. I mean, I love kindly annoying because kindly annoying. Examine your own decisions, try new things, see what works better. Because you try something, you want it like it. I've actually walked that walk in my own life prior to Dental Nachos, of trying new things in my practice, bringing new systems. I just enjoy that part. I think, unfortunately, dental school doesn't really encourage that. It's like we were talking with Fadi, and he'll talk to me, because sometimes they get too dogmatic with one thing. This is the thing. And I just say, why don't we talk about it and have these messy conversations that are just like my favorite thing, nachos. So I appreciate that, Dmitry. I'll let Fadi tell us about himself.
Yeah. For me, my name is Fadi Hasan. I moved to the States about 12 years ago, originally from Iraq as well, and did my dental school at Colorado and residency at VCU in Richmond, and I've been practicing for about 5 years now. Just like Dmitry said, I think for me, my favorite nacho is going to be soft tissue grafting. I got introduced to Dmitry through Instagram actually a couple of years ago. When I first joined, and lucky enough during this COVID crisis situation that we were actually able to have kind of 2 live, Instagram feeds, and talked a lot about soft tissue, bone grafting. So it was wonderful, great feedback that we had from it, and we just kind of said, like, we should maybe do something together in the future. And well, said, my friend Paul, Goodman, so from Dental Nachos, like. I've heard of him, but never had a chance to talk to him. So, that's where the whole introduction came through. So, I've been on Nachos very recently myself. So, shamefully I have to admit that. But yeah, hopefully this is going to be a future for all of us to kind of work together.
Well, and I appreciate Shannon. So, I mean, one of the things I say is BTL, bring to life. And bring to life to me as I bring to life you guys. So, Dmitry was kind enough. And even though we joked to come to Philadelphia, travel, leave his family, I really didn't pay him anything to come here. So I appreciate that, bring to life. But then I did say to him this time last year, pre-COVID, I said, I'm doing the Dental Nacho Supreme C on TV. I want you to be one of the speakers. You know what he said? I don't know if I'm too into video stuff. And now, yada, 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 we're here doing this. So that's the whole point of this Nacho world, is to bring to life people, good people who are doing stuff. I want you guys to share about your courses in a second, but to get a free watching pass to these next 2 courses, just text GUM to 215-543-6454 to register. So Dmitry, you're going to be first up on October 3rd. We're bringing you to life on the Nacho Network. Share with us your topic. Natalie's going to drop in how people can watch in and what people will learn on Saturday, October 3rd.
So we kind of, as Fadi mentioned earlier when we were chatting, we're planning kind of a big picture, obviously something regarding a soft tissue, but the topic that I'm going to be discussing will be kind of a half of the whole equation. So I'm going to be talking kind of very basic free gingival grafting, about the diagnosis of mucogingival defects, as well as some root coverage procedures, specifically VISTA procedure, and not the VISTA print where you get your business card. It's VISTA, aka vestibular incision subperiosteal tunneling approach, or access. So it's one of the procedures that me and Fadi are going to review in great details, hopefully in the near future. But the course is going to be just reviewing basics of soft tissue foundation before kind of Fadi takes over and do his part.
And I love that, Dmitry. I mean, as you're sharing that, I've been part of teaching 50 My First Implant courses or more. I teach with a periodontist. We co-teach, the Hasan model. It's been great. And one of the things that's cool about teaching that course is we've had so many people take that course who never place an implant, but they love the experience of doing it, talking to their patients, being a more knowledgeable provider. So it sounds like this is a really good first step for any GP who even wants to start to diagnose more and understand it. Is that accurate?
Absolutely. That's kind of I think the biggest thing, and I've been teaching this course for the last almost 4 years, regarding soft tissue and things that me and Fadi are going to be going over. But the biggest thing that I tell the GP or a dentist that takes a course like this is to learn a diagnosis. Maybe you may not be touching a specific procedure in the near future, but you'll be able to at least see the problem and maybe even refer it to someone who can. Yeah. If you want to learn how to do the procedure, we'll go over in a lot of details in that sense as well. But that's kind of the big topic, is to learn how to be able to diagnose a soft tissue problem and whether that soft tissue problem should or should not be addressed, or maybe may not be addressed.
I like that a lot, because I mean, even me, 18 years into doing this, you still struggle checking hygiene patients, doing stuff, knowing what to recommend. Is this something that can be treated, not be treated? I have an in-house periodontist who's awesome. Sometimes I used to refer stuff thinking, oh, this is definitely going to be treated. And he says, nope, don't need treatment. And I say, this one doesn't need treatment. It needs treatment. So you're going to do some more classic stuff, Fadi. Share with us about your course on October 10th. To join these courses for free, get free C, watch these two awesome periodontists. Just text GUM to 215-543-6454, or Natalie will share in the chat how you can register for that. So Fadi, tell me about your course.
So for mine, pretty much mine's going to be like the part 2. So I know, like Dmitry was mentioning, he's going to be kind of talking about, the free gingival graft and the VISTA approach, and kind of coming really honestly to understanding the diagnosis of of mucogingival deformities. I'll begin talking more about a little bit about the free gingival, kind of just showing like the different kind of clinical applications to it, whether you're talking about edentulous teeth, edentulous sites, implants, or natural teeth. And also other surgical approaches, like just the tunnel approach or the open flap techniques, for example, like the envelope technique. So I'll have a chance to kind of discuss the different varieties that we can actually utilize for soft tissue procedures, root coverage wise, and hopefully how we can, come up with a decision tree in a way that, which side works best, maxilla versus mandible, anterior versus posterior. And that's something like Dmitry was mentioning, that we discussed a lot about, kind of like what's our go-to technique for specific sites, and we have that discussion with other periodontists as well, and kind of coming on a consensus, like which one makes more sense to us, and, using autogenous versus non-autogenous, for example. So, dermal tissue matrices. So
I have to say, I've been I've been a dentist I've had an in-house periodontist since 2004, and we loved, recommending seeing the specialist to get insight. But I do remember maybe 2006 to 2012, where people said, I ain't doing that thing again, no matter what, because I have to get it taken from the roof of my mouth. I mean, I remember that almost where like the procedure turned out well clinically in the grafted site, but they just were unwilling to go through that again. So we've made, I say we have some procedures. Well, I want to share this, Fadi, a menu. That sounds so weird. Like, who would want a menu for if you have a deep cavity? Like, oh man, look, do nothing, do something, maintain it, remove it. So I love that menu of decision tree options, because that's what we need in the heat of dentisting battle. Which way do we go? What do we talk about? So we have 2 great courses coming up with you guys. Text GUM to 215-543-6454 to find out more. I know Dmitriy wants to watch the Lakers, but before you go, share with me a little, guys, of what this course will look like hands-on. If we brought something like this to the East Coast, dentists love details. You know our dentist people. Just walk me through the number of days and what people would be learning for something like this as we look to set this up.
So, you know, the courses that I've been doing, and again, the courses that I've been doing, which have been always 2 days long, hands-on, usually on the pig jaws, and as well as models. And because we're joining forces with Fadi, it's kind of like a completing the whole circle of all perio procedures. So we're going to make this hopefully a 2-day course. I know it sounds like it's a lot of information, but we're trying to maybe put in a lot of information in a 2-day hands-on course, which will include, you know, everything from A through Z, gingival augmentation and root coverage. And I think pig jaws, as well as models that include, you know, ability to do tabletop kind of surgery. It really strengthens the knowledge that we're trying to present.
I like that a lot, guys. And Fadi, we were talking before, like if I was to, you know, right now there's a weird time with the COVID and you can't do the courses and stuff, but it'll get back open again. It'll be doing stuff. But whether there was COVID or no COVID, people, I just got this message on Facebook. Should I go take a $20,000 implant course? I said, how many extractions do you do? They go, I don't do any. I said, well, do that first to prepare and take a course. Our Dr. Carl Kroner is one of our great, take a course in extractions. What could people do? Because I don't know, what could a general dentist be doing to prepare now in their practice or learning to get ready to take a course like that? Suturing more, or what are some things they could do, Fadi?
I mean, honestly, the way I see is like, you know, it's amazing. Sometimes, you know, there are a lot of those courses available. And if you don't understand the basics,
right,
you can't jump into the big stuff. Like you can start doing a tunnel if you don't know how to do a free gingival graft. So that's where I think me and Dmitry are coming in together, is that learn the basics, be good at it. And that's what you teach them in residency before they start giving you the bigger stuff. So, you know, start small. And like I said, suturing is the first thing. Literally, it's all about the detail. Like, and me and Dmitry and other colleagues, we pay attention to the detail of the suturing, how the knot sits, where it's positioned, just to give that final touch, you know, the finesse in it. So hopefully we can, you know, deliver, you know, our colleagues that, you know, and understand the importance of every step of the way and the thinking process of doing those procedures to really get that maximum result for them. So, you know, that's really the key, is that understand the basics, start with the simple stuff before you transition to the bigger cases where you might deal with a complication, then you start regretting, oh, why did I do this? So we don't want you in that regret mode. We want you to make sure you do it comfortably in the right way.
It's great training.
One more. Well, I wanted to add one more thing, and you know, the beginners, you know, me doing this course for over 3 years, so I've had beginners, I've had doctors that have been doing it for quite a while. I've had doctors, you know, I've had oral surgery, you know, post-oral surgery residents taking the course. I've had periodontists taking the course before. And it's not, you know, it's all about the delivering certain pearls to someone. Like Fadi mentioned, the way the knot lays sometimes to one person may not make a difference. The way you throw it forward, backward, forward, or just all forward, it makes a difference maybe in our eyes, and that's what we would like to convey. And a lot of these little pearls that you may not make a big difference maybe when you deliver it, but when you actually apply it, it may make a huge difference.
I mean, I love that. I mean, it's, you know, there's that good quote about always having a beginner's mind type stuff. You see in professional golf, I played a lot of golf in my day, like you see a PGA golfer giving a recommendation on a putting green to another PGA Tour golfer. And they're like, I'm so glad that PGA Dmitry gave me that tip. And that's what we should do more of in dentistry. You know, whether you're a beginner, whether you're someone who's experienced, because it's all about trying to do things a little better for your patients, make yourself less stressed out. So I love what you guys are doing. We'll get you guys to Philadelphia to have nachos at Alves when that is legal. It's open for 25% right now. Before we guys jump, I want to say this. I have to share, you know, give Dmitry and you a lot of credit. Your Instagram awareness of this course has been amazing. I do Facebook and Instagram. 27,000 Nachors, only have 5,000 Instagram followers. So how can people follow you on Instagram to see some of this stuff?
So yeah, please, you know, please guys check out our Instagram. Mine is Perio Implant LA. Hopefully we'll be able to share that in the comments section, and Fadi will share his.
Mine is fkh.implant.perio. So, I mean, again, I'm new to the Instagram. It's only been like maybe a year and a half, maybe not even 2. But, you know, check it out. I post everything's public, so anyone can watch anything and just
That's awesome.
have a chance to like it.
amazing account, Fadi. You've done really well in the last year.
You guys have had a lot of good friends. You know, you guys have got a lot of people sharing it. And then I think her name is Perio Princess on Instagram. She said it was her birthday on October 10th. So I said, we're going to bring her on to sing to her. And she said no. So now we definitely have to do that. So all 200 have to do that. She was great.
I'll
So
sing for her.
this represents all the stuff we're trying to do. Have fun, bring people together, learn. I appreciate you guys doing this. What I always do on these lives is just ask you guys if there's anything else you want to contribute before we wrap up about Nacho's, NBA basketball, your favorite suture material. I'll start with you, Fadi.
As far as I haven't watched NBA in a long time, I'm a huge Lakers fan as well. For me, just like Dmitry. I think favorite suture, I'm going to go with Glycolon, which is PGCL. That suture just works nicely. That's my favorite one.
You always want to know. Favorite club for PJ golfer, favorite suture for Periodonts.
Oh, yeah.
How about you, Dmitry? I'll let you wrap up.
Favorite instrument? Fadi, what's your favorite instrument?
Ooh, damn. I like the, from a soft tissue point, I like the Marcus Uzun Autos or the touch grip ones. I just got them recently. They've been nice with tunneling. Yeah, that's my go-to.
Nice. I love Boozer Elevator and I love 6.0 Proline. That's my go-to.
6.0 Proline, nice. Well, thanks guys for being great Nacho friends. Hang around for a minute. Nacho verse. Have a good rest of the night. And last call for this, text GUM to 215-543-6454. If you can't read this, it will be in the chat. Natalie will also put the Zoom links in. These guys are super kind to be offering this knowledge, complimentary chip gift. So watch in with us October 3rd, 12 noon, October 10th, 12 noon Eastern. Thanks so much, guys.
Take care.